the Buddha spoke about the qualities necessary to be both a good patient and also a good nurse, how to nurse somebody who's not well or doctor somebody who's not well, and to give them the right care. And their essential qualities are very much the same in many ways. One of the most important qualities, of course, is patience on both behalf of the patient and behalf of the person nursing them. One of the things that are big frustrations for many people is when they're sick, is that giving up of being able to look after themselves, which is a sense of independence, the sense of the freedom of being able to get up yourself and do the things necessary to look after the body, both feeding, bathing, etc. All those physical needs that the body has, and sometimes even being able to walk or even put food in one's mouth or go to the bathroom. So one of the big struggles for people is the mental struggle of having to give up control, and that sense of allowing other people to do things for one. And it's almost a willing to submit or willing to open the mind up to accepting the fact that one cannot look after oneself, and it's okay not to look after oneself. Often there's a sense of, I should be able to do these things, I've done them in the past, and I want to be able to do them in the future, so I'm going to push through them. But sometimes it's important to remember that it's okay not to be able to do things at certain times, and then it's okay to receive the kindness of others. So it's accepting the gifts, the kindness, the caring of others. And so that takes humility, that the other person is trying their best, the person looking after oneself or the sick patient is trying their best to take care of them as they see fit and possible, and that they're giving physical attention and kindness, loving kindness, goodwill to you, and giving their time and energy. So it's accepting that as a gift and seeing that the purity of that gift and the importance of that gift. And sometimes to see that, it's allowing the opportunity for other people to give to you. Sometimes for people, for example, if they've been parents and then they need looking after, they find it kind of frustrating that then when their children look after them, because they've always done that to their children. They've never been in the reverse situation. But actually to remember, it's a great blessing that one's children does help to look after oneself and give you assistance and care, and that's great merit to them. And so it just become a field for merit. So that willing to be a field of merit, to allow people to do merit to you, is one of the qualities of humility. That's one of the things that when someone becomes, say, a monk or a nun, they see that very, very quickly. That's often, when we come as a layperson, come to Buddhism and ordain, when people start offering us things and bowing down to us and kind of looking after us with a lot of care and kindness, sometimes there's a sense of, for young monks, embarrassment and a sense of, am I worthy of this? And they're missing the point. That's not the feelings that should be indulged in. That these people are doing something kind, generous acts to the Sangha, and because you've taken on the robes and put on those symbols, then you're worthy of receiving gifts. And so one has to make oneself worthy of receiving that gift in a patient and accepting and an open manner and appreciative manner. And so you're appreciating the gift. And that's one of the important rules of a monk, is to, when they're receiving a gift from lay people, is show great appreciation in that sense of, that is important. The act of giving is very important. So always receiving a gift respectfully and appreciatively. And so too is, it's exactly the same thing for a layperson when, say, someone is nursing one, that they're giving you a gift of kindness and care, and you have to accept it appreciatingly and sincerely and with respect to that act, to that care as well. So you're respecting the person who's giving it, respecting the act, and also, just allowing them to make merit in this act of generosity and nursing. And so that's a very important quality, this a mental acceptance of the situation, mental acceptance of the care, and often that's a big struggle for a lot of people, especially if they've been very independent and healthy most of their life. The other thing that's very important is patient endurance of the discomfort of illness. The Buddha said is, when there's discomfort in the physical body, there's also mental kind of anxiety and stress, and one has to be careful not to mix those two up, to be able to distinguish between the actual physical pain and discomfort and then the mental frustration, the kind of getting upset and angry at the physical discomfort or pain. And one, we can't avoid having a body. We have physical pain arises, but the mental problems and the mental suffering because of that physical discomfort we can avoid, and that's where our responsibility lies, is having that patience that I can wait, I can endure, I will pass through this is just a situation which will change, and having that ability to accept the discomfort, the problems, the pain, and whatever's arising with this sense of an open, equanimous mind, keeping the mind not delighting in the pleasure or pain. So it stays in the middle, so it just watches the feeling there's physical feelings, then keeping the mind based in a very balanced, even state of mind, not going to like or dislike. That's extremely important. So letting go of the mental discomfort is the most important thing too. The other thing is that the Buddha said for someone who is sick is they have to be willing to make adjustments to their life. And sometimes it's lifestyle adjustments. And they have to be willing to do that those things that increase the illness, for example, things you eat or certain things you may do, then if that increases the illness, one has to learn to avoid that and stop that. So that means that mental strength to say, no, I can't do that anymore, I can't eat that particular food anymore, I can't take those things that I normally take as I did in the past. I have to change my habits. So one's giving up things that are, say, going to be a cause for illness and reduce that those down, and then also the opposite, one has to take and consume those things that are going to relieve the illness. For example, if you have to have physiotherapy, then one's willing to put up for this, the problem of going to the physiotherapy, doing the physiotherapy. One has to take certain medicines and take certain foods, even though they might not be pleasant and likable. Then one, perseveres and stays with that taking of the medicine. And if one does that, then the person's looking after us, see that we're doing those things that are going to enhance our good health and enhance our recovery, and avoiding those things that are going to damage our good health and damage our recovery. So that's actually an important quality. And the other thing that one has to have is this sense of the person being looked after has to have a sense of kindness and gratitude to any care that they receive, which is loving kindness. Loving kindness to the people around one, loving kindness to the situation, so that one is just having a sense of inner well-being. And that inner well-being, that kindness to others also, the Buddha talked about as having a sense of being able to mentally deal with physical pain. So that takes a bit of training to learn to train the mind not to kind of get upset with pain, not to get sort of indulgent in pain, but to just stay a sense of, oh, that's just a condition which is coming through. We're going to investigate it and understand it. Is it permanent or impermanent? And so watching the pain with an open mind, with an observing mind, to be mindful. And that gives us freedom, because most people fear pain. Most people are under the pressure of the not liking pain. So when they kind of learn to step back and just know, staying with the quality of just knowing the pain rather than their like or dislike about the pain, then you can find that you can just observe pain. Oh, it's just a quality. And it's just like watching a fire. If you're sitting around a campfire, you can watch the flickering of the flames, and you feel its warmth, but you're not getting close enough to the fire to get burnt. If you want to put that fire out and you start stamping on the fire, then you're going to get burnt. And same with pain. What you can do is sit and watch the nature of the flickering flames of a fire. You can see its smoke, you can feel its heat, you can know its light and its darkness and brightness as it goes up and down in intensity. But you don't have to jump on the flames and into the fire. Same with pain. One can just watch the nature of pain arising and passing away, and without having to fight with the pain or trying to get rid of the pain or destroy the pain, just to know it. Know it just as you're observing the nature of a fire. And then when you know that, then the knower, the observer, and the pain become separate. The pain is one thing and the knower is another. And staying with that knower, that's the quality of the Buddha, isn't it? The Puru, one who knows, the awakened one and the blissful one, because he's awakened, blissful and knowing of reality and truth. So you become awakened, blissful and knowing of the reality of the physical pain. That's a quality that one needs to develop as when one is nursed, and that sense of just patient with the situation and time. For a carer, the qualities, as I said, for the carer is to see it as a gift, not as a gift that the other person should be appreciative of. It's a gift that a sense of duty. That especially as a carer, a husband to a wife, wife to a husband, father, parents, and mother to children, children to father and parents, to relatives and friends, brothers and sisters. When you're taking care, or for a disciple to their teacher, when you're taking care of something, those people who have taken care of you in various times in your life, and this is a time for you to repay that debt of gratitude. So that you're not being bounded by or in debt to people who have done a lot for you. You are grateful and appreciative, and gratitude and appreciation has to be repaid, the Buddha said. That's what we call it, gatanyu gataweti. Gatanyu is the gratitude, but gataweti is finding ways of repaying that gratitude, debt of gratitude. And often people are grateful for things, and that's even hard to find, people who are grateful for the things they've received in life. But to find somebody who will repay that gratitude, find ways of giving back to the people who have done so much for them, that's very, very, very rare. And so the Buddha said that they're the two types of heavenly beings that are rare in the world, the two types of dhamma qualities that are rare in the world is both gratitude for the things that we've received from people and the kindness we've received from people, and then gataweti, the repaying of that gratitude. The act of repaying is what we can do when we're nursing, looking after people who have done things for us. And even if they haven't done things for us, it's just a way of doing an act of generosity and kindness to another human being. And because we are very dependent on each other, one day we too will get sick and old and incapacitated at some stage possibly, and so we will need caring for. And if you've never done caring for anyone else, people are very reluctant to give that back to you. And it's often the case that we get back what we give, and that's just a natural cause and effect, a natural cause of Kamma. So if we do kinds of acts of kindness and generosity, then that's what we'll receive. And it was one of the things that's noticed with Lumpur Cha, that because he'd given us so much compassion and care and kindness in his time of sickness, then we were all willing to totally give back to him 100%, because he gave us more than 100% for sure. The other quality that one has as a carer is, of course, a lot of patience to the person who's ill, because often, tiredness can set in, frustration can set in, the kind of the difficulty of looking after somebody who's sick takes a lot of energy and a lot of time. So one needs to have that sense of, looking after one's own mind as well, and treating this as a way of practice, that I won't let the mind fall into negativity or tiredness or frustration, mental tiredness, frustration, because sometimes there's physical tiredness, but that doesn't have to mean mental tiredness. It's keeping the mind joyous and positive and wholesome, and thinking that, about how kusala this is, how wholesome it is, how beneficial it is, how much good kamma one is making. And when one does that, one sees it as this is an offering, a way of paying debt of gratitude, which is building your paramitas, building your good qualities, and you'll find that then you have the energy to keep it up and go through the difficult periods, the tired periods. And the other thing is, one has to have a lot of patience to the unpleasantness of looking after someone who's ill. There's coughing and there's phlegm, and people are passing kind of fluids out of the body, and one has to clean those up. So the Buddha said that one has to be very equanimous and balanced to the unpleasantnesses of coming someone who's sick. There's sometimes blood, and there's if someone's been injured or had a operation, and you've got bandages and things like that, and the smells and the kind of visual signs. One has the quality of a good nurse is to be able to see that and not get kind of disgusted by it, but is able to manage that and use it as a meditation, that, this is the nature of the body. It isn't pleasant, it isn't beautiful. We've kind of lost in that illusion. And that's often the case that disgust arises, is because we're being challenged in our illusion of beauty and our illusion of youth and our illusion of health, that should be that way. We should always be healthy, we should always be beautiful, we all should always be strong, we should always be kind of pleasant and good looking. And that's just the false illusion of the human body. It's not that way. And it quickly, if it is, it quickly changes. So, the nature of the body, seeing the true nature of the body, is one of the great meditations, so that we don't get attached to our bodies and other people's bodies. So developing that as a meditation. And the other thing that the person looking after a sick person has to have to be kind of wise about medicines, wise about food, that will not kind of stimulate the illness and also kind of hinder the cure. And so, one has to be knowing to give at the right times and what not to give. But also sometimes to, give mental encouragement too. That's another quality the Buddha said is a good nurse is someone who gives mental encouragement for the person to be strong, to be patient, to endure what's unpleasant, and to give them, in Thai they say, it's a word called kamlang jai, which means energy of the mind, energy of the heart, which means encouragement really, to give them mental encouragement, to uplift them and inspire them. And that sometimes means, to be pleasant and chirpy, but also positive and kind of talking about dhamma or talking about their good qualities, telling them all the things that they've done in the past, which is noble and good, encouraging them to remind that, so that they keep their mindfulness. And that's one of the things that is extremely important, is you're encouraging the ill person to be mindful and to develop wisdom and to contemplate. So the Buddha said that a skillful nurse is someone who gives a reflection on Dhamma at the appropriate times to encourage mindfulness and wisdom about the the state of the body and mind, so that that encourages them on the path. And so, these qualities are all very important, and the qualities that the Buddha praised. And, there's patience, there's perseverance and endurance, but also the knowledge that looking after a sick person is a great merit, great blessing. And, if we're doing that and letting other people see that, so for example, if parents look after their mothers and fathers and their children see that, then that will be, cause for them to see the example, see the responsibilities that we have to each other as human beings, living together as family, living together as a community, having that compassion and kindness. So I'll leave that as a reflection on caring and illness. So the patient has certain responsibilities, and the carer has certain responsibilities and certain skills they need to develop and focus on. And so I hope that's useful to you.